It's just a constant nagging pain down your legs and in the center of your back.
It's kind of like there's a knife being spun inside of your spine, but then imagine that with extreme pain.
It's kind of like my constant companion. Sometimes it gets worse, sometimes it's a little bit better, but it's always been there.
Back pain is very, very common, and it can be much improved with appropriate assessment and treatment. Back pain is probably the second most common major pain that people will have on an ongoing basis. We spend a lot of time talking to patients, getting a perspective of what happened, what makes the pain worse, what makes it better, what positions aggravate the pain. And then we address treatment based upon what are the likely causes.
I thought it was just like pulled something in my hip maybe, and then the pain would just progress until it was unbearable. So I met with Dr. Leisman. I felt trust right away, like, okay, this is gonna be good. He decided we're gonna do the cortisone injection. Throughout the entire process, everybody in the room is great, and right away you feel better. That night when I went home, I actually slept on my side for the first time in 6 months.
There's a wide variety of pain procedures and pain treatments that can be offered. The idea of doing the procedures is to decrease the pain so that people are able to move more and able to move better.
And you just let me know if I get to a spot that hurts you, okay?
All right. I've had back pain for about 25 years. When I met Dr. Mintzner, she seemed so committed to doing something to get me to feel better. So I felt pretty comfortable from the very first visit that maybe I was in the right place. It's nice that the staff seems to work together so well. They do everything they can to make the experience as easy as possible. Even during the treatment, there's like 2 nurses in there who are always very supportive and attentive to me. I'm just very grateful that I have found the Pain Management Center.
There are different people with different specialties that will contribute to your care, but we all work together to try to improve your pain.
How does it feel doing this?
It's okay. It started out as sciatic problems. I woke up one morning and couldn't walk. When I met with Dr. McHale, he said, I'm going to do everything I can to get you better. We had gone on a cruise about 6 months before, and I was in a wheelchair. Well, after Dr. McHale did the mild procedure, I was walking around without my cane. It was wonderful.
There's so much hope for people to get better, so that's why we really do this.
Waking up in the middle of the night almost in tears because you're in so much pain, and then to all of a sudden not have that anymore, it's amazing.
I'm able to do so much more than I did before, and I'm very grateful for that.
I can't tell you what it's like to not have pain once you've been having it for a long time. It's made me feel so much better. It really has.